So you hear the term skin cancer, and what do you think? You probably picture one single thing. But the truth is, not all skin cancers are created equal. There's a huge difference between a really common, easily treatable spot and one that's rarer but much more dangerous. Today, we're diving into this tale of two cancers, and honestly, understanding that difference could make all the difference. Let's just kick things off with the fact that really sets the stage. Basal cell carcinoma, or BCC for short, is the single most common skin cancer in white adults across places like the US, Europe, and Australia. This isn't some rare disease we're talking about. Its sheer numbers mean it's a topic that touches almost all of us in some way. All right, here's our roadmap for this explainer. We're going to start with the big picture, what we're calling the unseen epidemic. Then we'll introduce our two main characters, BCC, the common one, and melanoma, the rare threat. After that, we get super practical, how to tell them apart, what happens if you find something, and, most importantly, how to protect yourself. Okay, first up, the unseen epidemic. We're calling it that because even though skin cancer is incredibly common, a lot of us don't really grasp the true scale of the problem. So let's get a handle on the landscape here. And that leads us to the million-dollar question, right? Is every weird spot or new mole the same thing? Does every kind of skin cancer carry the same risk? The answer, you've probably guessed, is a huge no. And knowing why is exactly what we're here to break down. So it's time to meet the first major player in our story. This is the one you're most likely to encounter, the common culprit, basal cell carcinoma. So what is BCC, really? Well, it's a type of skin cancer that grows from specific cells in your epidermis. That's the top layer of your skin. And the number one cause? No surprises here. It's all about that long-term, repeated exposure to sunlight. Okay, so what should you be looking for? Well, there are a few classic signs. You might see these pearly or pinkish bumps, sometimes with raised, waxy-looking edges. Or you might notice tiny little blood vessels on the surface. But honestly, one of the biggest red flags is a sore that just won't heal. You know, one that scabs up, maybe bleeds a little, and just keeps coming back. Now, this is probably the most important thing you need to know about BCC. It can definitely be destructive right where it is, damaging the skin around it, but it very, very rarely spreads to other parts of the body. Just kind of lock that fact away, because it's the key difference we're about to see. All right, let's bring out our second character, melanoma. We're calling this one the rare threat, because while you see it less often than BCC, it is, without a doubt, the more serious adversary. Melanoma grows from a totally different cell, called a melanocyte. You can think of these as your skin's little pigment factories. They're the cells that make melanin, which gives your skin and hair its color. This is why melanomas often show up as dark brown or black spots. It's a cancer of the pigment cells. Now, this right here is the most powerful tool we have for spotting a potential melanoma early. It's the ABCDEs. A is for asymmetry, one half doesn't look like the other. B is for an irregular border. C is for uneven color, maybe patches of brown, black, even red. D is for a diameter bigger than a pencil eraser. And E, which might be the most important, is for evolving. Is the spot changing? That's a huge sign. And this really gets to the heart of the paradox with melanoma. It's not the one you see the most, not by a long shot, but it's responsible for most of the deaths from skin cancer. And why? Because unlike BCC, it has a serious potential to spread. Okay, we've met them one-on-one. Now let's put them side by side. This is where it all clicks, and those crucial differences become crystal clear. This table lays it all out pretty perfectly. Think of it like this. BCC is the high-volume cancer. It's way more common, looks like that pearly bump, and its main threat is local damage. Melanoma, on the other hand, is the high-stakes cancer. It's less common, looks like that weird changing mole, and its big danger is its ability to metastasize or spread. If you want one super simple way to think about this, here it is. This chart shows it all. BCC's bar for incidence, how often it happens, is sky high. But melanoma's bar for mortality, its impact when it does happen, is way, way up there. High volume versus high stakes. That's the core story. Okay, so let's say you've spotted something and you're thinking, what now? Let's walk through what happens next. We're going to demystify this whole process, because knowing what to expect is half the battle. And it shows you why acting fast is so empowering. You know, the path is actually way more straightforward than you might think. It starts with you notice a spot. Step 2, you see a doctor.
If they're concerned, they'll do a really simple biopsy to take a tiny sample, and then that sample goes to a lab to be looked at under a microscope. That's how you get a final answer.
And if you need just one reason, one single reason why acting fast is so critical, this is it. For melanoma that's caught in situ, that means it's in the earliest stage, just in that top layer of skin, the cure rate with a simple surgical removal is over 99%. Let that sink in. Early detection is basically everything. And here's more good news. For both cancers, when you catch them early, surgery is the gold standard and it works incredibly well. Most BCCs are removed with a simple procedure. Early-stage melanoma? Same deal. A surgical excision is often curative. The takeaway here is so clear. For both of these, finding it early means simpler treatment and a fantastic outcome. All right, we've talked about spotting them and treating them, but you know what's even better than early detection? Prevention. So let's wrap up with your guide to sun safety, real actionable things you can do to take control. And the best part is, this stuff isn't rocket science. It's really just a few smart habits. Try to avoid the sun when it's strongest. Make sunscreen a daily thing, not just a beach thing. And wear hats and long sleeves. And please just stay away from tanning beds. It's also so important to be extra careful with kids, since a huge chunk of our sun damage happens before we even turn 18. And finally, remember that prevention also includes being your own best advocate. That means doing a monthly self-check. Just take a few minutes to look over your skin for anything new or different. It's one of the most powerful tools you have, and it's totally free. So, we'll leave you with this final thought. Your skin is your body's largest organ. It works 24/7, protecting you from everything. The only question left is, what are you going to do to protect it?